And speaking to Professor Marc Mendelson, we're talking about the report that the NICD, that's the National Institute for Communicable Diseases, they put out their Sentinel report stating that 10,700 COVID-19 admissions have been made in the 9 provinces. So we're just running through that and looking at some of the key findings in that report. Professor Mendelson, thanks so much for staying with us this morning. So as I was asking before we went to the news there, people complaining that it would seem that every death now is classified as a COVID-19 death. So is this something that you've come across, and what have been your deliberations around this particular matter?
So the NICD, data that you're talking about looks at confirmed deaths, the COVID deaths from pneumonia or from other causes where COVID-19, the virus causing COVID-19, the novel coronavirus SARS-CoV-2, has been detected. So we suspect that there are patients, certainly now we're in the Western Cape, we have such a large number of patients now and an experience around this, that one's starting to be able to make a clinical diagnosis. So some patients, unfortunately, will succumb very early on in their illness, even potentially before a test is back or has been even sometimes has been taken. And it's fairly clear from the clinical presentation that person had a very high chance of dying from COVID-19. I mean, it's difficult to give you specific, to answer the question specifically for different people's perceptions, because it does depend a little bit on whether the person was actually diagnosed with the virus or not. And when people are coming into hospital, people who do have symptoms and signs that could be COVID are being treated as COVID-19 until proven otherwise. And some of those people, as I said, will die. But if they're confirmed COVID, then that will be registered on the death certificate. And COVID-19 is now a notifiable disease, a notifiable infection in South Africa.
So speaking of being notifiable, so as you said, most people may present with mild symptoms and they may not even know that they are COVID positive. But we've also seen many workplaces have to shut down, Professor Mendelson, for a period of time when people do test positive. How do you suggest workplaces deal with such instances?
Yeah, so I think the problem is that, you know, we are in a time now within South Africa and within this epidemic that there is really massive community spread, particularly within the metros, and we've seen this in the Western Cape. We've seen this and we're seeing this now in Gauteng, Eastern Cape, KZN, which are just lagging slightly behind the Western Cape, but the numbers are increasing. And as we've also eased lockdown and people going back to work, you're going to get many people at work potentially who have COVID-19. Now, remember that, you know, of everybody who's infected, there's going to be about 50% or so, we think, who will never know they've been infected. And then there are also people who will develop symptoms, but have a period of days before they develop the symptoms when they're going to be potentially infectious. And so rather than shutting workplaces and other areas, I mean, it depends. Obviously, if there's a major outbreak, that needs to be reviewed. But the really critical issue around opening up the workplaces is the non-pharmaceutical interventions that we put in place to try and reduce transmission. And again, those come back to the simple issues of social distancing, universal masking, hand hygiene, and regular disinfection of surfaces at work. And then if somebody is symptomatic, that they do not come to work. It's really important that we don't actually have presentism. In other words, people coming to work who are sick, because then there is a greater chance of transmission. And people let their guards down in the workplace as well. Although there may be real attention at a customer interface to all these things that I've just talked about, one then goes into a tea room or into a communal area and the guard is let down. And therefore, the really critical issue about opening up the economy and opening up businesses is that we really attend to these critical issues, central issues to reduce transmission.
And then with regard to the field hospitals that were set up, Professor Mendelson, how are they coping at the moment, given that we are told we haven't quite peaked yet and we've already had 10,700 admissions? How are those field hospitals coping in the various provinces?
So I can really only talk to a little bit of experience that we've got in Cape Town. As you know, the Cape Town International Convention Centre has opened 850 beds as a field hospital. I think over the last week or so, 10 days or so, they've been increasing gradually the numbers of patients that are being transferred there or being admitted there. And I think that the field hospitals face the same challenges as the hospitals that are already underway. I think one of the critical issues is staffing, and that's clearly a major challenge. But the CTICC has oxygen supply, it has pharmacy supply, and again, the staff that are there are extremely committed, and it's being led by an incredible command structure. So I think they play a critical role, particularly in intermediate care. So again, I think we need to see in the narrative again a positive part of this, because again, there's some rumours around that going to a field hospital is a bad thing, and that you're not going to get good care, and that it's a step back rather than forward. But actually, that's not the case. We are transferring from Kudaskia patients who have been sick are now stable, and it's a progression home. There are also admissions to the field hospitals of other patients, clearly, but the field hospitals will play a critical role in improving capacity, despite, again, major challenges that they too are facing.
And those infographics that you see courtesy of Media Hack. So, Professor, just as we start to round up this interview, the report also talks about advisories on the use of high-flow oxygen for patients who are very ill but can be managed without intubation and ventilation. Please tell us more about this, and if we could also just talk about the correct use of ventilators, for example, for COVID-19 patients, and do we have enough of these mechanisms in place at the moment, this equipment, the ventilators, for example, and oxygen stations for the patients?
So to talk to the high-flow nasal delivery of oxygen by high-flow nasal cannulae or tubes into the nose. So I think, again, putting it into perspective, oxygen can be delivered in a variety of ways, and it really depends on how much oxygen needs to be delivered. So many people who come into hospital will first require just low volumes of oxygen. Those can be supplied just through little cannulae into the nose. They may, as one increases the amount of oxygen, you may need a face mask, and then a face mask with a special bag on, which again increases the amount. And then prior to requiring mechanical ventilation, there are these modalities such as high-flow nasal cannulae and something called CPAP, which both are mechanisms to deliver oxygen, more oxygen, and that particularly with high flow, which is oxygen that's humidified. And that really increases the amount of oxygen that can be given and reduces the work of the lungs. And what we've found through our experience, but also in international experience, which has been invaluable, is that ventilation is really at the end stage of this process in terms of the pathway through oxygen delivery. And actually, high-flow nasal oxygen delivery, or CPAP, can, really markedly improve outcomes of people who would otherwise have had to be ventilated. And our outcomes and our program, led by my colleague Professor Calegaro at Gauteng and in other hospitals across the country, are seeing benefits from this modality. And it may be slightly over and above that survival rates that we're seeing in patients who are mechanically ventilated. However, it would be wrong to say that mechanical ventilation plays no part. It's a critical part of the jigsaw of the management of patients. It's necessary for certain patients who either are going to fail high flow, or where there aren't high flow facility for high flow or CPAP. Mechanical ventilation is potentially life-saving. And again, although the mortality is high in people who are on mechanical ventilation, it is not universal, and we are seeing patients who are coming off ventilators and surviving and being discharged. So it's a continuum of care. In an ideal world, one would have an unlimited supply of all of this. But we in South Africa live in a limited setting, and we have a finite number of beds, finite number of ventilators. But critically as well, when you're talking about the ICU, it's also about staffing, because and particularly nursing staff. So when a ventilator is a machine and a bed is a bed, but you need people who are skilled in working the ventilators, helping the ventilators, and monitoring, evaluating the patient in a very high care setting. And that requires trained people and numbers of staff. And that's one of the major challenges. So I think the important lessons here are that we are learning and seeing real improvements with oxygen delivery, short of mechanically ventilating patients. And then again, it's also played into improvements I think we're going to be seeing through the introduction of new treatments, such as dexamethasone, which has been widely publicised over the last 10 days or so, is also a new modality, a new treatment that we're using prior to the ICUs. Steroids have been being used in ICU for a prolonged period, certainly in the COVID pandemic. They've been commonly used by critical care practitioners throughout the country. But the game changer here was the recovery trial, which showed that dexamethasone in patients who were requiring oxygen but not mechanical ventilation also benefited from treatment.
Professor Mendelson, thank you so much for your time this morning. Professor Marc Mendelson is the head of infectious diseases and HIV medicine at the University of Cape Town and is also part of the COVID-19 Ministerial Advisory Committee, talking to us there about the current situation regarding the coronavirus in South Africa. Right, let's bring you a sport.